ನಮ್ಮ ಹೆಸರು ಶಿವಕುಮಾರ್. ಸೊ ನಮ್ಮ ಮಗಳು HS ವಿದ್ಯಾ. 6 ಇಯರ್ಸಲ್ಲಿ ಇವಳಿಗೆ ಸ್ವಲ್ಪ ಏನೋ ಬೆಂಡ್ ಆಗಿದೆ ಅಂತ ಅಬ್ಸರ್ವ್ ಮಾಡಿದ್ವಿ. ಅಷ್ಟೊಂದು ಗೊತ್ತಿಲ್ಲ, ಬಟ್ 10 ವರ್ಷ ಆದಮೇಲೆ ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಬೆಂಡ್ ಆಗಿರೋ ಥರ ಕಾಣಿಸ್ತು. ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟಲ್ ನಮ್ಗೆ ಮುಂಚೆ ಗೊತ್ತಿತ್ತು. ಹಾಗೆ ನಮ್ಮ ಮನೆ ಹತ್ರ ಮಣಿಪಾಲ ಸರ್ಜಾಪುರ ಐತೆ, ಬಂದ್ವಿ ಡಾಕ್ಟರ್ ಹತ್ರ.
So I examined the patient. The child did have an obvious noticeable hump in her back, which was more pronounced when she bent forward, and there was a curvature of the spine as well. And on further examination, the child did not have any neurodeficits. We sent the child for CT and MRI scans. The scans revealed a hemi-vertebra at 2 levels in her spine, at D12 and L2. So we call this congenital scoliosis. Not a very common disorder in comparison to the more common adolescent idiopathic scoliosis. This is comparatively rarer. So they approached us at the correct time, because even 2 years down the line, this deformity would have worsened in magnitude and would have become a lot more difficult to treat.
ಸ್ವಲ್ಪ ನಮಗೆ ಭಯ ಅನ್ನಿಸ್ತು. ಓಕೆ, ಆಮೇಲೆ ನಾವು ಅರ್ಥ ಮಾಡ್ಕೊಂಡ್ವಿ, ಬಿಕಾಸ್ ಇದು ಬರ್ತಾಗಿ ಬಂದಿರೋದ್ರಿಂದ. ಸೊ ಅದೇನೋ ಆಲ್ಟರ್ನೇಟ್ ಆಪ್ಷನ್ ಅಂತ ಗೊತ್ತಾಯಿತು. ಹಾಗಾಗಿ ಸ್ವಲ್ಪ ಟೈಮ್ ತೊಗೊಂಡ್ಬಿಟ್ಟು ಆಮೇಲೆ ನಾವು ಡಿಸೈಡ್ ಮಾಡಿದ್ವಿ, ಆಪ್ರೇಷನ್ ಮಾಡಿ ಸರಿ ಹೋಗುತ್ತಂದಮೇಲೆ ಆಪ್ರೇಷನ್ ಮಾಡಲೇಬೇಕು ಅಂತೇಳಿ ಕೊನೆಗೆ ನಾವು ಆಪ್ರೇಷನ್ಸ್ ಮಾಡಿದ್ವಿ.
So the surgery planned was hemi-vertebra excision. We went ahead and did an excision of D12 and L2 hemi-vertebra using a microscope and a surgical drill called the Midas Rex drill. So an important point to note here is that these surgeries, spinal deformity correction surgeries in young children, is particularly risky because it puts the spinal cord at risk. To avoid this possible complication, we made use of intraoperative neuromonitoring, in short IONM. Now this is a very useful tool to any spine surgeon or a neurosurgeon, so that we can do this surgery, we can correct the deformity safely without causing any lasting spinal cord damage or paralysis. So we went ahead and we did what we planned. The surgery lasted for around 5.5 hours, and after 5 hours the child came out of the anesthesia, was moving all her 4 limbs, and she recovered well.
ಈಗ ಅವಳಿಗೆ ಏನೂ ತೊಂದರೆ ಇಲ್ಲ, ಎವ್ರಿಥಿಂಗ್ ನಾರ್ಮಲ್. ಸೊ ನಾವು ಎಲ್ಲರಿಗೂ ಥ್ಯಾಂಕ್ಸ್ ಹೇಳಬೇಕು ಡಾಕ್ಟರ್ ನವೀನ್ಗೆ. ಹೋಲ್ ಹಾಸ್ಪಿಟಲ್ ಲೈಕ್ ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟಲ್, ಸರ್ಜಾಪುರ ಹಾಸ್ಪಿಟಲ್ ಇಸ್ ಗುಡ್ ಆಕ್ಚುಲಿ.
Thank you doctor, and thank you Manipal Hospital for treating me very such good and making my life more improvement.